All right, it's about 12:01, so we're going to get started here. Welcome everyone to the American Lung Association's Community Connections presented by Novant Health and Wells Fargo. I'm your host, Carrie Beal, Health and Wellness reporter for Spectrum News. A few housekeeping items before we begin. This webinar is being recorded and will be available after the session. Please submit questions for our panelists through the Q&A button. We will do our best to answer all the questions at the end of this session. We encourage everyone to complete the survey at the end of the session. This will help guide us to create future sessions. Today's discussion will focus on back to school lung health. We understand that many people have concerns about returning to in-school learning. What are the current COVID protocols? How can we ensure the safety of students living with respiratory conditions? How does air quality impact lung health? Our presentation today will explore concerns, answer questions, and start a conversation about what you need to know as parents, school faculty, and caregivers to ensure a safe return to school. Now I'd like to introduce our esteemed speakers. Dr. Leah Erickson is a pediatrician in Winston-Salem, North Carolina. She received her Bachelor's of Science in Biology and Medical degree from Wake Forest University and attended the University of Colorado for her pediatric residency. She was instrumental in opening Novant Health Waughtown Pediatrics in September of 2017, a clinic located in a medically underserved and primarily Spanish-speaking neighborhood designed to decrease barriers to care, including access, language, and transportation. She is the Novant Health Pediatric Physician Executive Leader for the Winston-Salem market. She also serves on the Novant Health Equity Council and was awarded the Forsyth Medical Center Founders Day Distinguished Physician of the Year in 2019. Monica Damian is the Coordinated School Health Specialist for the Charlotte-Mecklenburg School District. She has served in this role since 2015. She has a Master's of Public Health specializing in health behavior and health education from the University of North Carolina at Chapel Hill. Prior to working at Charlotte-Mecklenburg Schools, she has focused on HIV and AIDS, working as the Director of Prevention Services for a nonprofit clinic and in HIV research. She is passionate about health promotion and disease prevention and supporting the health and well-being of students in her district. Next, we have Candace Cahoon. She is the chair of NC Clinicians for Climate Action. She is a respiratory therapist that specializes in asthma education in Eastern North Carolina. She is a board-certified asthma educator, pulmonary function technologist, and case manager. She is a climate and health advocate and has utilized her experience with underserved populations in Eastern North Carolina to act as their voice within congressional halls through her activity with the Medical Society Consortium on Climate and Health. As climate change continues to wreak havoc on the health of asthmatics in the area, she continues to educate on appropriate steps to take to alleviate the burden and overcome triggers created by natural disasters. Dr. Erickson, let's start with you first. As students go back to in-class learning, tell us how parents and students should prepare for a safe return.
Thanks so much, Carrie. And I really appreciate the opportunity to be here and share a little bit today in this important conversation. So the first thing that I want parents to think about is how important the COVID vaccine is in ensuring the health and safety of students as they return to the classroom. The good news is that the vaccine is safe and effective and available in North Carolina for anybody over the age of 12. We would strongly encourage parents to get their children over the age of 12 vaccinated if they haven't been already. And one of the best ways to protect children under 12 who aren't eligible for the vaccine is to make sure that the parents in the household or other adults in the household are vaccinated. One other thing that's important to remember is that some families have delayed healthcare during the pandemic, but it's really important, especially if your child has a chronic condition such as asthma, that you touch base with your pediatrician before the child returns to school. Make sure that your child is on any type of controller medications that they've been prescribed in the past, that their chronic conditions such as asthma are under good control, that you have an asthma action plan available, that you have necessary medication refills, and that you know how to take care of your child's condition if they would to have symptoms when they return to school. The third is one thing that's been really interesting this summer is that we're seeing a resurgence in respiratory viruses that we don't normally see in the summertime, such as RSV and other respiratory viruses that are actually triggering asthma exacerbations that we don't normally see this time of year. So if your child has asthma or a chronic respiratory condition, really be on the lookout for signs of respiratory viruses such as cough or difficulty breathing, and please call your primary care physician or pediatrician to have them checked if they need that. We also want to make sure that families are on the lookout for the flu shot when that's available this fall. We would recommend that for all children as well.
Okay, and you kind of answered some of the questions I have here, but just tying back a little bit, for those children who are under the age of 12 and are not eligible right now for the COVID-19 vaccine, what is the risk of contracting COVID-19 as they return back to school?
So that's a good question. I think one of the most important things that we can do is encourage all children to wear masks when they return to school. And I know that's a little bit disappointing. We were hoping that we weren't going to be in this situation with the Delta variant increasing right now as we return to the classroom, but all children that are school age, when they return to school, regardless of vaccination status, when they're indoors especially, it's really important that they keep their mask on. And even now, when they're not back in school yet, when they're in indoor spaces, when they are around people that aren't members of their household, we would strongly recommend them starting to wear masks again in order to stay healthy and prevent COVID.
Okay. And there is concern children will be at high risk of respiratory infection because they've been isolated for an extended period of time during the pandemic. What are your thoughts, and is this based on fact or myth?
So it's true, and it's really unusual. We're seeing a lot of infants right now with a respiratory virus called RSV that can cause breathing difficulties, and sometimes they need to be hospitalized if their oxygen level is low. And we don't normally see this in the summer at all, but we do think that this is spreading now that kids have been back together and having play dates, maybe back at camps and daycares, and not wearing those masks. And so it's really important to be on a lookout for that also.
All right, well, thank you so much, Dr. Erickson. Candace Cahoon, we're going to move on to you next. Tell us how poor indoor air quality impacts children and what can be done to improve indoor air quality.
Hey, Carrie, how are you?
Good, how are you?
Good, sure. So you kind of have to consider the fact that the respiratory illnesses we're talking about are trigger diseases such as asthma. Meaning they're worsened by those triggers. They're exacerbated. You have a lot of issues when you're coming in contact with such stuff as cleaning supplies, mold, kerosene heat, scented candles, dust particles from carpets, mattresses. All of those airborne issues in the home can cause swelling in your airways as well as bronchospasm.
And what about outdoor air quality? How does outdoor air quality impact those living with asthma and other respiratory diseases? And are some groups more susceptible than others?
Definitely. Some are definitely more susceptible than others. Anybody dealing with a respiratory issue or a cardiac issue to begin with is going to have more issues with air quality. You know, the best way to take care of it is kind of eliminate the irritants, avoid carpets if possible, vacuum floors, mattresses weekly, limit stuffed animals, limit your animals in the bedroom especially, clean any mold you may see in your bathroom and make sure it's well ventilated.
I did not know that about stuffed animals.
Yeah.
Thanks for that tip. We're hearing a lot about wildfires recently. Can the wildfires out west impact lung health here in North Carolina? And what other natural disasters impact respiratory health?
So for sure, air currents travel all the way across the country. We can definitely be impacted those. Typically young children and older adults are definitely more impacted by that. Something we don't typically connect with health is the aftermath of hurricanes and how they affect our bodies. The cleanup is what usually triggers the asthma. You have to think of flooding with hurricanes. When you have flooding, you have increased dampness, which means you have increased mold, increased cockroaches, which are also an irritant that can trigger an asthma attack. It's the perfect storm, really. And then you have products to clean up. That's another thing you're going to have an issue with after the aftermath of hurricanes.
Okay, thank you so much. And now we'll move on to Monica Damian. Let's talk more specifically about school preparedness. The CDC recently recommended that all students and teachers in K through 12 schools wear masks and in-person learning, and Governor Cooper supported similar recommendations. Can you tell us what the state's protocol is for returning to in-person learning and how those decisions are made?
Yeah, thank you so much for having me today, Carrie. So as you said, the CDC and the state and our local health department all support the universal masking in the school setting. Recently, we have reviewed our local data with our public health metrics, along with consulting our local public health experts. And what we determined was we believe it's the most effective and important way for us to bring our students back into the classroom where they can be the most successful at learning in person. So we supported universal masking, which was the determination that the state had as well.
And describe the exceptions that can be made for those students with behavioral development, health, religious, or other concerns.
Sure. So last year we had followed the governor's executive order related to exceptions to the mask requirements. And we are in the process of revising our form since the executive orders expired. Now we're looking at how to implement a similar process using our requirements within the school district. So we do plan to continue with the same guidelines related to behavioral, developmental, and medical reasons, or issues, conditions that can substantially interfere with a student's ability to wear a mask during school hours. So we're revising that form and we'll have it available to our families to complete any exemptions and notify us of any concerns with their students.
Okay, and I know you still have a few weeks until, 2 weeks now until school starts. So, and with the cases of the Delta variant on the rise, what is CMS doing to ensure an either safe return to in-person learning or alternatively at home learning?
Yeah, that's a great question too. We continue to maintain protocols, safety protocols in place that we had last year that we know are the right precautions in a school setting. So as they talk about the Swiss cheese sort of model of prevention, where we layer all the methods that can help protect, because we know that not one thing is 100% effective, but we do believe that keeping those masking requirements in place and reminding kids and staff to keep distance as best they can, as well as reminders about hand hygiene. And also, we ask our families to continue to monitor for symptoms at home, keeping students at home if anyone is symptomatic or exposed to COVID, as well as reminding our staff that they need to stay home as well. And we're also really, to piggyback on what Dr. Erickson said earlier, we're really encouraging anyone who is eligible to get vaccinated to step up and do their part to help our community.
Well, thank you so much. And this has been a great dialogue. Let's open up the conversation to our viewers so they can ask questions as well. Please submit your questions through the Q&A button. We will do our best to answer those questions. We already have some that have come in. Dr. Erickson, Zanetta wants to know, how can I keep my child's lungs healthy and strong?
So thanks for that question. I think one of the most important things to think about is what your child's lungs are exposed to. So making sure that your child is not in an environment where they are exposed to tobacco smoke. That's one of the biggest things that can impact lung health. Doing our part to try to keep children protected from respiratory viruses, such as we know that COVID can cause long-term respiratory damage in children. It's less likely to than in adults, but we have seen children that have had long-term breathing issues. And if you have any concerns at all about your child's lung health or breathing, please make sure to bring that up with your pediatrician.
Okay. Thank you, Dr. Erickson. And we have one more for you. Jennifer wants to know, how are pediatric asthma patients at higher risk of getting COVID-19?
So pediatric asthma patients are not at higher risk of getting COVID-19. One thing that's been kind of interesting is we did not see as much COVID triggering asthma exacerbations last year, as we were fearing that it would. And it's hard to know why that happened, whether some of the controller medications might have been protective against COVID. Also, families who have children with asthma might have been more careful in making sure that they kept their mask on or were socially distanced. But one thing that we do know about this virus is that it's constantly changing, unfortunately, and we don't know if there might be another variant coming that could possibly cause children with asthma to be at higher risk. We do not know that respiratory viruses are one of the biggest triggers of asthma attacks or asthma exacerbations or needing to be hospitalized with asthma in children with asthma. And so we want to do what we can to protect our children from any type of respiratory virus that could potentially lead them into difficulties with their asthma. So that's why we do recommend the COVID vaccine for children over the age of 12, with especially those with underlying medical conditions. We do recommend masking for children in school. We've actually done studies on children where we have them wear a mask and we watch their oxygen level and just make sure that it's not interfering with their breathing. And pediatric pulmonologists, the ones that study and take care of the sickest kids with asthma, they recommend masking for all children with asthma to protect them from COVID.
That's very good information to have. And kind of on that topic, Steve asked, when will a COVID-19 vaccine be available for children 12 and under?
So we're hopeful that sometime maybe late fall is what I've heard, that they're predicting that the results of the studies will come out. We're just waiting for the final results to make sure that the COVID vaccine is safe and effective for that age group.
Okay, thank you so much. And Monica, I think this next question is for you. Do the schools have a COVID-19 testing plan in place for staff and teachers?
That's a great question. As we continue to move forward and work with community partners, we do have some plans that we're working on to get in place. Things change so quickly with this virus that we are hesitant to move forward with a plan until almost the very last minute, but we are looking at opportunities for making testing available on site through a grant that the state has for testing. We're gonna also look at opportunities to provide diagnostic testing. So if a student is at school symptomatic, we can test them hopefully on site, where we will be able to know whether they need to go home and quarantine or follow up with a healthcare provider to determine what else is going on. So we are working on those plans right now.
Okay, and Monica, moving a little bit away from COVID-19, several guests have asked questions regarding vaping. What do we know? Vaping is still an epidemic among teens. What is the school district doing to prevent youth vaping right now?
Yeah, that's a great question. The middle school and high school students do have health curriculums that cover prevention and strategies to reduce vaping. Students are not going to be getting a whole lot of information in other areas besides the health class, but there are some resources out there that they will receive in the health classrooms as far as getting support and help if they're involved in vaping, and how to prevent even starting to.
Okay, good to know. Candace, we'll go to you now for this question. It's about air quality. Jill wants to know, how can I protect my child on bad air quality days? We had a few of those last week. And what are the signs and symptoms that poor air quality is impacting my child's health?
So just like Dr. Erickson said earlier, just always remember to follow your asthma action plan. Make sure you remain on those maintenance medications that the child has been prescribed. Make sure you have access to your rescue inhalers in home and outside of the home. When you know we are having those bad air quality days, have them wear a mask outside. Limit the time they spend outside. Different signs and symptoms are pretty much the same as any other trigger. You're going to see shortness of breath, complaints of chest pain, wheezing, coughing. Just follow that asthma action plan.
All right, and Candace, I'm going to keep you here for this next question. Luba asks, some asthmatic medications are immunosuppressive, however, not systematically immunosuppressive. So which asthma patients do you flag as immunosuppressed?
I'm going to point that one towards Dr. Erickson.
Yeah, that's a really good question. So a lot of the asthma controller medications that we use do include inhaled corticosteroids that work directly on the lungs to decrease inflammation in the lungs and to prevent asthma exacerbations. And corticosteroids as a group are considered immunosuppressant, but the doses that we use in most children with asthma would not affect their immune system in a way that would cause them to be considered immunosuppressed. If a child needs to be on oral steroids, which is something we really try to avoid, which is why we use the other types of control medications that can suppress their immune system. So keeping their asthma under control, using their asthma action plan, keeping them on their chronic daily medication to prevent them from needing the oral steroid will help keep their immune system healthy. And there is some data that in children with asthma that need that inhaled corticosteroid that can prevent possibly severe COVID infection in them also.
Okay. And I'm going to keep you on. I think this question is directed to you as well. If you are attending a school without a mask mandate, should I get my child tested regularly out of precaution?
So we don't recommend regular testing of children unless there's been a known exposure or they have symptoms. But this school year, just like last year, if anybody has symptoms of that could be consistent with COVID, sore throat, headache, fever, cough, congestion, vomiting, diarrhea, definitely loss of taste or smell, do not send them to school before you get them evaluated and have them tested. And then we do recommend testing if there's been a known exposure. But if there's not an exposure and they don't have any symptoms, we don't recommend testing at this time.
Okay.
And if there's not, sorry, I just wanted to add, even if there's not a mask mandate at your school, please feel free to have your child wear a mask at school, and that will help to keep them safe.
Thank you. And this one could be for you, Dr. Erickson or Candace. Can poor air quality impact kids who don't have asthma or another respiratory condition?
I can take that one. It can impact all of us. Kids are more susceptible because they have a reduced lung capacity. Their airways are still forming. So that's why, you typically see more issues with them, but it can definitely impact all of us. You just kind of have to pay attention to how you feel. If you're outside on a great day, you may be able to do whatever. You're outside on one of those poor air quality days, you find yourself coughing. Get a little bit short of breath faster than you would on a normal day. So yeah, it can impact you. You just kind of have to pay attention to your body and make sure you pay attention to them as well and any symptoms they may show.
Okay. And then this next question might be for Damien. Does the school system have a stock bronchodilator, I hope I said that right, policy in place, and can children self-treat in schools?
Okay, so I'm not aware that we have a stock policy related to bronchodilators. We do require medical orders in place, documentation of the need, an asthma action plan in place for any students who may have an inhaler or need any treatments, any breathing treatments. And we really ask, we have nurses in the buildings, but we require that those orders are on file and completed in order for us to know the best treatment for our students. There is, depending on the independence of the student, the age of the student, maturity, ability to keep track of things, there's an option for them to self-carry medications such as asthma inhalers. And that again goes along with the medication administration forms that a doctor would complete with the family, discussing the student's ability to self-carry and be able to treat themselves in the school based on those orders from the doctor.
Okay, and I think I have one more question for you, Monica. Do schools use naturally based cleaners and disinfectants versus chlorine-based cleaners that can cause asthma symptoms to flare up?
So I am very good friends with all the environmental health specialists in our district, and they do, I don't want to speak out of term related to what is or is not in the products that they use, but they're definitely aware and mindful of any sort of potential irritants that can be in cleaning products, and they do limit things. There is not chlorine-based products, bleaches or anything like that in cleaning products. They are typically, and I'm going to say it wrong, but I know there's like a grading system for safety with cleaning products, and they typically look for the lowest rating possible to be able to use those in the school systems.
Okay, and Jill has a question for Dr. Erickson. How is asthma diagnosed in young children, and how do I know if my young child is having asthma symptoms?
So asthma is really something that needs to be diagnosed by a physician. And typically children present with recurrent wheezing episodes with colds or respiratory viruses, or sometimes coughing with exercise. So those are the main symptoms that we see. It's difficult to tell if a child is wheezing without a stethoscope. So sometimes parents will use the word wheezing just because they can hear their child breathe, but that might just be from mucus in the back of their throat. But if your child has had more than one episode of wheezing, needing a breathing treatment or inhaler that your physician has given them, if when they run around and play outside, they have to stop and cough and kind of catch their breath, if they wake up at night coughing, especially when they're not sick, those are all potential symptoms of asthma. And I would encourage you to take your child to their pediatrician to get that checked out.
Good to know. We are waiting to see if there's any other questions coming in. We still have a few more minutes. So if anybody's watching this and wants to submit a question, we have 3 great experts here that have answered an array of questions, actually. So I've learned quite a bit just tuning in. So I'm going to leave this open here. If there's anybody else that has any other questions for our panelists, again, Dr. Leah Erickson, Candace Cahoon, Monica Adamian, they all have their specialties, but it's in the range of pediatrics, asthma, and CMS in some of their protocols. So again, if anyone else has questions, we will happily accept them. We'll hang out here for maybe about another minute. If there aren't any more questions, or if anyone has follow-up questions, you can always submit those later as well. But it looks like right now, not getting any in. So we had quite a few here. So this has been a great conversation with all of the panelists here. I've learned a lot. I know a lot of people watching have learned a lot, and it's nice when you can get those viewer questions answered. As a reporter myself, I'm always the one asking questions, and sometimes I miss things. There's things that I would think to ask, but viewers want to know something else. So it's really great to have them tuning in and asking their questions from their personal experience, point of view, or concerns. So I want to thank everybody for attending today's Community Connections presented by Novant Health and Wells Fargo. I hope you found it informative, and a special thanks to our panelists. Again, Dr. Leah Erickson, Candace Cahoon, and Monica Adamian. Please remember to complete this survey. Your feedback is very important to us. For more information on COVID-19 vaccines, visit novanthealth.org or American Lung Association at lung.org. You can check your email for a recording of this session. So if you heard something, you want to hear it back again, double check, make sure to do that. There's also going to be some additional resources in that email. So again, thank you everybody for attending. We really hope you have a wonderful day and a good weekend.
Thanks.